I grew up in Miami, Florida. I went to college, undergrad at University of Miami, and then moved on to Northwestern University in Chicago, Illinois. I then did my surgery training in Chicago at Rush Medical Center, and I did a fellowship at the University of Chicago. I then lived in Cleveland for a little while, practicing at the Cleveland Clinic. I next worked at the University of Minnesota, and then I moved here about a year ago. I came to Baylor about a year ago as I was fascinated by the opportunity to work in this surgery department that has such a great history. I was looking forward to working with the colleagues that I had met here and to being part of this robust medical school and residency program. The patients that I generally see are typically patients with hernias. This has really become my primary area of clinical focus. I really like taking care of these patients, particularly very complex cases that are either recurrent or have had problems in the past.